So, you know the supplement Allimax. I'm sure you all carry it. I'm amazed at how popular it's become in Canada, and you have so many different pack sizes that we have trouble keeping up in the UK with all the different packs that you have. But it's made by Allison International, and the first study that we sponsored was an antiviral study on the common cold. Why is it called the common cold? Well, that's because every adult in the Western world suffers between 2 and 5 colds per year. And your children suffer between 7 and 10 colds per year. So it's the children that often bring the infection home from school and pass it on to their brother and sister, their mum and dad, their grandpa and their grandma, and the whole family gets basically infected. And that's why Health Canada follows infection rates every single week during the cold season, because we know that the common cold virus can lead on to influenza, and influenza can kill. And every year, in Great Britain alone, we lose at least 12,000 people a year dead because of a cold. Now that really shouldn't happen, right? Because it's a simple virus that we should be able to deactivate. So, we know there are more than 200 different cold viruses, and that's why, the injection every year is never going to be perfect, because nobody knows what cold virus is coming along this season. We'll be telling you more about that in just a second. But what we do know is that viral disease is a great traveller, and people travel all over the world. I couldn't believe how busy Toronto Pearson Airport was when I arrived. There were thousands of people from all over the world, and unfortunately they don't just bring their luggage in. They bring in their viruses, their bacteria, their funguses, they bring in their parasites, and they go into an environment where their guts do not recognise Canadian food, even though it's wonderful, don't get me wrong. And that means that infection can spread amongst them, the travellers, but also amongst the general population. They get onto a bus or a train. Every train seat contains about 3 million bacteria. 72 different species of bacteria on a train seat. So for God's sake, don't sit down. Men don't wash their hands when they go from the bathroom. It's estimated that 73% of men do not wash their hands when they leave the bathroom. So please, ladies, don't ever shake hands. All right? Because that's an infection risk, all right? And even these wonderful, fabulous air dryers that are so fashionable and have made one of our men so rich, Mr. Dyson, that he's moved all his manufacturing to Thailand or somewhere because he wants to make even more money. Can you imagine what happens when you don't wash your hands properly? Nobody does, okay? Nobody washes their hands properly. You put that into these air dryers, what happens? Boom! Straight up in your face immediately. You're covered with bugs. You are covered with bugs. You walk out of the bathroom, you do this to your hair, you do that, you do this, you're spreading infection. You go and say, hi, hello there, yeah, nice to meet you. Man, don't shake hands, right? And that spreads infection. It's really, really easy to spread infection. And that's why the cold is called a common cold, okay? So, it costs national economies like Canada millions of dollars every year. People phone up on a Monday and say, oh, I'm sick, I'm not coming to work. They take the whole week off, and you've got to put up with trying to find extra staff to cover, right? So it has a huge cost. And we say, as doctors and researchers, prevention is always better than cure. And I'm mindful of the time, but I'm doing okay. And this is what's coming to you now, this month, okay? This is Australian flu, which is the worst season that they've had for more than 10 years. Thousands of people infected, thousands of people dying. The death rate is about 30%. So this Australian flu is now reaching the West. So it's in America, it's in Britain, it's in Canada, and that means that your season is going to probably be elongated and particularly bad. So at the end of the day, you're probably going to be able to sell a lot of Allicin, and that will be good for everybody because it will prevent them from getting sick. And if they do get sick, we'll show you in a minute how quickly they can get better. So let's do that now. This is basically where we are. It's a cold war attack. The cold virus attacks everybody. What you've got to do is boost your defense. We know that we can boost your immune system with allicin. We know that we can actually defeat the cold virus, and more importantly, we can prevent it from a secondary infection. That's a really important point to take on board. And I'll show you that now in the clinical trial. This is 146 patients, double-blind, placebo-controlled. It is now seen as a gold standard for natural product research, and it's quoted all over the globe by medical databases as well as herbal and alternative treatment databases. And I'm very proud of it because I was the author, and the results were quite dramatic. So, here in a placebo group, i.e. dummy capsule, 65 colds in total. Here in the active group, taking just one capsule of Allimax per day, 24 colds. P, 0.05. In other words, if you repeated that study 500 times, you get the same result. Same result each time. In other words, immediately that somebody comes into one of your stores and buys a box of Allimax, they are 60% less likely to catch a cold during the Canadian winter. Now that's got to be good news. Keeps them fit and healthy, keeps their family fit and healthy, keeps you with customers coming back for more product, which is good. And that means that we can reduce the cold infection rate each year. And that's really what we want to do. And if you look at the next slide, these are the number of days that these people were sick. So it's not a cure for the common cold, because look, the people that caught cold in the active group, they were sick for just 1.5 days. So they were taking one capsule a day. A few of them got a cold, but they got better in just a day and a half. Whereas in the placebo group, it took them on average 5 days. Now, I've already mentioned my dear old mum once. She passed a long time ago. But she always used to say to me, Peter, a cold is 3 days to come, 3 days on, and 3 days to go. So that's 9 days, 3 days to come, leave that out. 3 days on, 3 days to go. She was pretty much right. So we should listen to our predecessors, because they knew their onions. Absolutely. Or their garlic, of course. And the last thing that comes from this particular study, there are a few other features, but this is very important. The number of repeat infections, i.e. did people get sick more than once during the trial period? Yes, they did. Placebo group, 16 got more than one cold. In the active group, only 2. P, 0.001. Repeat that study 1,000 times, you get the same result. So it's a preventative and a treatment. And that's why it's so important for you to promote it during the winter period particularly. But as you know, summer colds are nearly as bad now as winter colds. So it's an all-rounder. It should be used all year round. And you can see that it can prevent the cold, it can reduce symptoms, it can reduce reinfection, it could save a lot of money to the Canadian economy, and it's very well tolerated. There were no major side effects reported in the study. There was one lady that had to come out because she had a bad knee, and it turned out she was on placebo. So that wasn't anything to do with the stabilised allicin. And they used the manufacturer's recommended dose. Now we suggest that if you want to stop a cold, you take 10 caps in one go, and you won't get your cold will disappear overnight. The next day you'll feel great, and it won't come back. So take a big dose when you feel it's needed. And what we've worked out over the last 10, 15, 16 years, it can't possibly be that long, but it is. We know now that allicin goes well with vitamin C, it goes well with ginger, it goes well with arginine and cayenne pepper, it goes well with maca root and ginseng. And if you add some of these components in to stabilised allicin, you get what's called synergy. Now that's really important now, because we're going to talk about Allimax control.